Good morning. I picture myself before the big presentation. That's what I call this. A lot of high achievers, they have to speak in front of big groups, small groups. Doctors go on grand rounds, for example, in their white coats. You can see them all there if you've watched Grey's Anatomy, walking through the halls. They go into maybe a room. There's a patient in the bed. The senior doctor, the attending, maybe of the internal medicine or surgery, whichever type of care this patient is getting, looks around the room at the younger doctors. There are doctors who are in medical school. There are doctors who are wearing long white coats. They are actually higher than the medical students. They're residents. And the doctor, there are fellows who have a different colored coat, I think, or maybe their coat is a little bit different length. The attending surgeon looks at one of them and says, "Please tell us about this patient." Doctor's throat gets all tight. His chest filled with tension. He knew going into it this morning that he was going to be called on because this was a patient that he had been working with. He knew last night when he prepared his notes, and he prepared them so well, outlining all the things that an attending doctor would want to know about the symptoms this patient had before they came into the hospital, procedure the patient had here at the hospital, a little bit about the age of the patient, what the patient's treatment protocol is. In fact, the doctor knew maybe a week ago, because last week at Grand Rounds, the attending surgeon pointed to the doctor and said, "It's your turn next week." Maybe it was on a schedule. But nonetheless, we find ourselves in there, about to talk. Our throat is tight. We can hear our heart beating in our ears. It's too late. Maybe it's not too late. And on other videos, I'll talk to you about what we can do right then. We can belly breathe. We can stand up straight, pull our shoulders back, take a slow breath in, slow breath out. But right now, I want you to think about what we can do to prepare better. And this goes out to all you doctors. I want you to use what I call visualization of the end. The visualization of the end. I want you to see yourself successfully completing the talk. I want you to see yourself in your white coat, walking out of the patient's room. You're feeling the taps on your shoulder from your colleagues. You're seeing yourself in a reflection of a door as you walk out, maybe smiling, maybe with your face calm. Maybe you see a little bit of your teeth. What do you see at the best of you at the end of your presentation? That's where I want you to start your visualization. I want you to really see how you're dressed. What are your shoes? What pants are you going to wear? Are you going to wear any extra pens in your pen pocket? See yourself feeling your best. What does feeling your best look like? We know that feeling our worst often feels like we're rolling up into a ball, our shoulders in, our chins down, our eyes are all closed, stomach is tight. What does feeling your best look like? Does it look like our chin is up, shoulders are back, stomach is relaxed, our face is relaxed? We're not squinting our eyes, we're not pursing our mouth. That's where I want you to begin. So let me know if you can send me a video of exactly what you see when you see yourself finishing your task successfully, confidently, and proud. Go out there, but first, see yourself